Hi, everyone. Good afternoon.
Hi, good afternoon.
Thank you for
Hello,
joining
good
us.
afternoon.
Hi, good afternoon. Yeah. So we'll just wait for a few minutes for others to join and then we'll start. Thank you.
Okay.
Perfect. I was waiting for it to be 3 p.m. on the dot. Good afternoon, everyone, and welcome to another session of ACE webinars. So glad that everyone has joined us. Um, Thank you for joining us today. Thank you for joining us for this important conversation titled Partnership and Collaboration, Building Strategic Alliances for Sustainable Health Impact. My name is Dr. Victory Ekpin, and it's so nice to be here. I'll be your moderator for today's session. On behalf of ACE, I just want to say thank you very much to everyone joining us for taking time out of your busy schedules to be part of this call. It shows our commitment to building and fostering partnerships and sustainability within the public health space and the larger development space. And very special thanks to our panelists for joining us today. I know that our panelists are very busy people and they've taken time out of their very busy schedules to join us today. I'm very delighted for your presence. Thank you. But before we proceed to the main session, just some housekeeping rules. Please kindly note that you are to keep your, okay, first of all, this meeting is being recorded. I hope that everyone is okay with this. We are going to be recording the session. And also, please, if you are granted permission to speak, after speaking, kindly mute your mic so that we don't disrupt the session. Yes. Please use the Q&A icon to ask questions at any point, right? There's going to be a session at the end where we use the raise hand feature to ask questions. But while we are speaking, whether it's the keynote speaker or during the panel session or during the reflection session, please feel free to drop questions in the chat box and we're going to ask them either during the panel sessions or when it's time for the Q&A session. So if you want to speak during the Q&A period, please raise your hands. All right, so going straight into the session, we have a full and engaging agenda ahead, so let's get started. Yes, so today's discussion is centered around how can partnerships move beyond just coordination and working together towards actually making strategic alliances that deliver sustainable health impact. To explore this, we are joined by an exceptional team, an exceptional group of leaders on policy, implementation, and innovation. And we're also joined by the ACE managing partner, who I will be acknowledging later. And so thank you to everyone that has joined us. Now, let me briefly introduce our keynote speaker. So we go straight into the keynote. Our amazing keynote speaker is here. Miss Ota Aibe. This is someone that I have admired from afar for a long time, and I'm very glad that um, I am admiring her from close now, close up now. Ms. Ota is the Director of Partnerships and Programs at eHealth Africa, where she spearheads strategic growth by developing and executing strategies that secure critical collaborations within international and indigenous governments, NGOs, and private sector entities. Her expertise in strategic planning, resource mobilization, and stakeholder engagement has led to significant improvement in healthcare access and service delivery. Ms. Ota has been she has been widely recognized for her leadership in sustainable development and inclusive partnerships, and has been named among the top 60 African women in the development space and top 100 career women in Africa. And she brings a deep practical knowledge of what it takes to make work, what it takes to make partnerships scale. So it's my absolute pleasure to invite you to take the keynote address. Ms. Ota, welcome and thank you for being here. Oh, if you're speaking, you are muted.
Thank you so much, Victory, for that introduction. Good afternoon, everyone. And thank you to the ACE group for convening this conversation. Like Victory said, I'm Ota Higbe, the Director of Partnerships and Programs at eHealth Africa. And I think my discussion today is not really about partnerships as a nice word. A lot of us are familiar with that word, partnerships. In someone like me who has been in this space for almost 2 decades, partnership is like what I hear every single day. But what I will be presenting today is about partnerships as a serious operating system for sustainable health impact, especially in a world where resources are tightening. We know what is going on in the global development space and in the world at large. Expectations are rising and communities still need results that last. So for the next few minutes, I understand I have about 15 to 20 minutes. I just want to give us a simple frame on why good intentions don't always translate into impact, and also what high-performing partnerships do differently. And so the first thing I'll be talking about is on the topic, why good intentions don't always translate to impact. So when you look at some partnerships that fail, I have come to understand that partnerships don't fail because people are bad. Partnerships underperform because we build them on activity and not alignment. So we have a lot of brilliant people delivering services, brilliant people shaping policy, committed people financing programs. And also we have communities that are doing their best to trust the system. But too often, each group is most likely optimizing for different incentives. So we have a group that is optimizing for timeliness, some for visibility, some for reporting, some for politics, some for funding cycles. And so we end up with something that looks busy, but doesn't compound into the system change that we're ultimately looking for. Because at the end of the day, it's an ecosystem where we really just want to bring about system change. And the outcome is predictable. When everyone is optimizing for a different incentive, what happens at the end of the day is there is fragmentation, there is duplication, and obviously there would be short-lived gains as opposed to the sustainable gains that we want to see. So the shift I'm inviting us into today is simple. We need to move from transactional partnerships to strategic alliances that are anchored in shared outcomes, that have clear governance, and that very importantly, come up with long-term value. And next, I'll be talking about what it means to go from that goodwill to clarity. So the truth I have learned the hard way is that high-performing partnerships are not built on goodwill alone. Clearly, they are good intentions. Most times people come together with good intentions. Sadly, it's not about good intentions, High-performing partnerships are built on clarity. And when we look at clarity, what are we talking about? So clarity on the shared outcome upfront. So from the get-go, there is clarity on what is the outcome we want to get out of this partnership. Also, clarity on incentives so that partners win together or adjust together. So it's really clear from the beginning. Also, clarity on governance, not more meetings, but decision rights, the governance around how the partnership will run. I always tell my team something that is for everybody is for nobody. There has to be governance to understand who makes the decisions and all of that. Then clarity that trust can't sit only in personalities. It has to live in structure. It can't be dependent on people alone. It has to live in systems and structure. And very importantly, clarity that technology, when done right, becomes the infrastructure for transparency and learning, and in most cases, scaling. So when all of these things that I've mentioned are in place, collaboration becomes durable and then impact skills, which is what we want. Next, I will now talk about patterns for high-performing partnerships. I'd like us to make this very practical. So across high-performing partnerships, the same patterns show up. First, you will notice a common agenda that is specific. There is a specific agenda. And it is not just about saying, oh, we want to improve outcomes. No, it's not that. But a shared problem statement with a shared definition of success. So the partners have to come together to really come up with a common agenda that is specific. Second is shared measurement and data discipline. So there is one results framework, one cadence, one honest view of progress that the partners agree on. This is the direction we're going in, and this is what we're committing to. Third is clear governance. I mentioned governance earlier. So there has to be decision rights, and it's not about having multiple meetings. Meetings are good, but it's not the solution. So each partner has to decide in this partnership, who decides what? How are trade-offs made? How does escalation work? These are things that have to be agreed with the partners. Fourth is comparative advantage. And this is where complementarity is the sweet spot. The truth is, everybody doesn't do everything. Every organization doesn't do everything. Every person doesn't do everything. So each partner plays their strength in a mutually reinforcing way where I am strong, I can you may complement and leverage on that strength. And where I'm weak, I can leverage on your strength. And I think that is really a sweet spot in partnership. Fifth is local ownership. It's non-negotiable, especially when we look at Nigeria, Africa, it's important, wherever it is, really. Local ownership is a watchword. We align with government priorities in our space. It's important that we align with government priorities and that we use national systems, not just trying to do this partnership in isolation or in parallel to what the government is focused on. So we don't build site structures that disappear when the funding ends. Rather, we imbibe local ownership so that it's sustainable even when funding ends. And the sixth thing is a credible backbone function. So a small, trusted coordination capability that holds the agenda and sustains momentum beyond personalities. So there has to be like that. Different partners call it different things. Sometimes they call it a working group, a committee, a secretariat, whatever, but a small, trusted coordination capability that really just holds the agenda of that partnership and ensures that the momentum is sustained. So for anyone listening to me, if you remembered nothing else in my presentation, I would like you to remember this. Partnerships do not scale on good vibes. They actually scale on design. It has to be intentional. It has to be done deliberately. And that is exactly how it will scale and how it will last. Next, I would like to talk about what makes partnerships work. And I like to boil it down to 4 essentials, and I'll keep it very plain. The first essential in my mind is trust. Without trust, we have nothing. So partnerships only work when there is trust. and trust that is built by design. Again, not by good vibes, but by design. It's transparency, it's predictable follow through, and of course, it's fewer surprises because each partner is open to the other partner and trust the other partner, and they're not thriving based on suspicion. Next is shared accountability. And that means there is one scorecard, there is one cadence, we agree upfront on outcomes, and we review the performance together, not in parallel universes. That is the next one. Accountability is very important. It's difficult, but it's important. Third is interoperability, and that is the collaboration infrastructure. So at scale, when we look at partnerships at scale, partnerships is really about whether systems can talk, data can flow safely, and decisions can be made from the same truth. So interoperability is really, really important when we're looking at collaboration and partnerships. And I think the fourth one is adaptive leadership, because the hardest problems are not technical. After all said and done, sometimes the hardest problems are human resources, relationships management, and all of that. And this is where leaders surface trade-offs, manage power dynamics respectfully, manage ego, and keep coalitions moving even when priorities shift. And that is really what makes partnerships last beyond a project's timeline. Next, I'll talk about something that, clearly in the space we are is very important, which is technology as infrastructure. So on technology, I'll say something that sometimes surprises people, and that is we actually don't need more gadgets. We actually don't need more apps. What we need is better plumbing of whatever it is that we have right now. So technology should enable shared systems, not side systems. The role of technology is an enabler, right? So when we look at things like shared registries, dashboards, interoperable health information systems, things that really connect actors and reduce duplication, that is what I would consider responsible use of technology, where we're using that tech to enable all of these things. The next thing still talking about technology as infrastructure, the second thing I'll say there is that it's important that we standardize data so that decisions are empowered, not debated endlessly based on sentiment or relativity. And third, I would say is automate coordination so that learning accelerates, so that it's plug and play, so that regardless of who comes next, it can easily be adapted. So when performance is visible in real time, course correction becomes collective. Fourth, I would say, is fix the plumbing, not the gadgets. Fix the standards, fix the governance wrappers, fix the security, the user experience. These are things that are really important, when we're looking at technology as an infrastructure. And the fifth thing I would say is design for scale from the start. So from when you are designing the whatever it is you plan to use to enable the solution, it's important that from that start, you design for scale so that later, when things are scaling, it doesn't affect or disrupt the flow that you have. Technology only scales partnership impact when it is built as shared infrastructure that really reinforces trust, transparency, and accountability. So we now need to move on to the next thing, which is what must change in 2026. This is such a timely webinar because we're smack right at the beginning of the year, and it's important that we have these conversations that are more important than ever, which is partnerships. So what must change practically as we look at 2026? The first thing I believe must change is a shift from activity reporting to shared outcomes. It's not about what we did, it is what changed. So obviously, I've been in a lot of partnership conversations, and sometimes we get into the creep of just reporting the activities week on week, month on month. We need to change that. We need to focus on what we did, focus on what changed, not just what we did. The second thing I think needs to change in 2026 is design collaboration into systems, not just pilots. So pilots are good because they provide an opportunity for us to test that something is going to work at scale, right? However, it's important that when we are designing collaborations, we design them into systems that would endure beyond that initial phase of the collaboration. And it's important that we look at it from that perspective. The third thing I would say is to align incentives, not just intentions. The beautiful thing about partnerships, and one of the things I realized is for a partnership to work, every partner has an incentive, and there's no shame there. Every partner is looking to get an incentive out of the partnership, and we need to own it, and we need to be proud of it, and we need to communicate it and know that it's okay. But we need to align incentives, not just in intentions, and that's something that's very important when we're looking at partnerships. The fifth thing I would say is, or rather, the fourth thing I would say is to institutionalize governance, not meetings. We don't want more meetings this year. We want governance. How is this going to work? How are we coordinating it? That every time we meet, it actually makes a lot of sense. We actually are able to see how much we've progressed. And then I'm going to talk about putting ownership where impact lives, which is the national and subnational leadership, investing in adaptive leadership, which I talked about earlier, because power dynamics are real, ego is real, and it's important that we invest in adaptive leadership and that we can manage them with maturity. The last thing I'll say on that is to build sustainability by design with handover and funding pathways planned from the outset. And I'll add a simple reality we all feel. Right now, the global development environment is shifting, started shifting a while ago. It's becoming coming with tighter funding, more scrutiny, more uncertainty. And that is exactly why we need partnerships that are serious. We need partnerships that are structured. We need partnerships that are locally anchored, not fragile coalitions held together only by goodwill. So we need to be very intentional looking at the landscape of what we have right now in the world. And next, I would now move to how do we move partnerships from intentions to collective performance. So let me just land this with 6 lines that anyone listening can run with. The first thing I would say on this is we need to treat collaboration as infrastructure. I have talked about this before. And what that means is a designed way of working that outlives funding cycles. It is just too important that we do that. The second thing is we need to define shared outcomes first and then activities second. Activities can only come when the shared outcomes are clear. Then activities are a byproduct of that clarity. We also need to align incentives so that success is collective, not competitive. I'm really serious about incentives. We need to understand that every partner has an incentive for that partnership, and that is okay. But we need to align it such that we understand that if you win, I win too. If I win, you win too. And so we can work together to make sure that we all win so that it's beautiful success rather than competition. The next thing I would say on that is we need to institutionalize governance and accountability. Who decides? This is really tricky, but in a partnership, it's important that we're clear on who decides, how decisions are made, how course correction happens, so that we avoid staying stuck in blame game and pointing fingers. We also need to invest in interoperability and shared systems. Let us invest in technology and data that binds us together. And maybe the final thing I'll say is center community legitimacy and country ownership. Because partnerships that are not locally anchored don't last. So it's very important that whatever it is that partners are doing, we center it on country ownership, we center it on community legitimacy, and it will really, really last, and we'll find there will be ownership even at the grassroots. And that is how we shift from good intentions to collective performance. So Victor, I hope I didn't go ahead too much into my time, but thank you so much for giving me the opportunity to make this presentation. and the work that you continue to do. I'm looking forward to the panel discussion, and I'm especially looking forward to learning from my fellow panelists and also from the managing partner of ACE Strategy and from the questions in the room. Thank you, and over.
Thank you so much for that very, very insightful session. You are just within time. So thank you for that as well. And yeah, some of the things that you said have really resonated with me. I mean, one of the last things to talk about was the systems, the fact that without the system, it's the partnerships must be anchored on the system that already exists. And in our context, it is basically the health system run by the government. And that's why we have the government in the room anyway. But it's something that is very important and oftentimes missed or taken, would I say, lightly. But I'm very glad that you've been able to point that out today. And please, if you have questions or comments or anything else, please put them in the chat box. We're going to be going over to the panel session, and those will be brought up if you have questions. If any questions are directed at Ms. Otta, we're going to ask her during the panel session, and also questions that come up from when we speak collectively. I will go ahead now to introduce the other members of the panel so that we can go right into that. So first of all, I'm very happy to introduce Dr. Olusegun Samuel Oyeniyi. Dr. Oyeniyi is the director and head of the Reproductive Health Division, Department of Family Health at the Federal Ministry of Health and Social Welfare. He serves as Nigeria's focal person for every woman, every newborn, everywhere. The IWIN, I always wonder how to pronounce this, project, and also the Family FP 2030 and postpartum hemorrhage rollout. With over 25 years of experience in the health sector, he has received both national and international awards. He's well-renowned, and he holds a Bachelor of Medicine and Surgery from the University of Ilorin and an MPH from the University of Ibadan. So just a little before I introduce Dr. So when I came to ACE, I always hear about, Dr. Oyeniyi, Dr. Oyeniyi. I went to browse and do a little bit of reading about Dr. Oyeniyi. And he is not only, while working in the government system, he's an accomplished author and of publications, and has grown within this space to be a name that even if you type the name, you would know that he has been able to set a name for himself. So it's my honor, Dr. Oyeniyi, to have you here, and thank you very much for honoring my request to be here. And I will go ahead to introduce Dr. Nonso, our very own. Dr. Chukwu Nonso Wakere is a principal at Solina Center for International Development and Research. He leads the implementation of the Polio Africa program, focused on improving polio outbreak response across 9 African countries. He also leads maternal health initiative under the Smile for Mothers program, which aims to reduce maternal mortality due to postpartum hemorrhage across 7 states in Nigeria. He is a medical doctor and a public health professional and has over 9 years of experience in program design, implementation, and management. Dr. Nonso has, with all the projects and programs Dr. Nonso has led, he has hands-on experience in managing complex multi-partner programs. So he actually has managed a lot of collaborations and partnerships. So I'm very happy for you to be here, Dr. Nonso. Thank you for honoring our invitation. Okay, so going right into it, one of the things that Ms. Otta spoke a lot about was hammered on, that I took note of, was designing into systems, right? And in Nigeria, the system is owned by the government, or is one of the key players, the major player is the government, and then the rest of us is kind of like a hub and spoke. The rest of us rally around the government to make sure that the government leads, and then we follow. So I wanted to ask, my first question is to Dr. Oyeniyi. From the perspective of the Federal Ministry of Health, why are partnerships critical to advancing our health space, especially in a country like Nigeria? Why are partnerships from from subnational government, from implementing partners, from donors, why are they critical to achieving our national health priorities? And what role does the government play in, convening and steering collaborations and partnerships across the country?
Thank you so much. I want to use this time to appreciate the convener for giving us this opportunity as a government, and also to encourage all other partners that are working with us. So it's a great opportunity. So thank you so much. And thank you for the question. It's very critical. As government, of which the Federal Ministry of Health and Social Welfare is championing in terms of health, one of the why it is very critical is that there is a need to coordinate the partner. And in the areas of resources, need to pull resources together. It's not something one person can do. There are other priorities for government. So it's better that you pull resources together, especially funding need to be pulled together from various sources to achieve the goal. And what is the goal for everybody? The goal is to crush maternal mortality and other mortality, as it were, around health. That is our major goal, and that is where we need that partnership to key into, so that everybody can put in their various inputs to ensure that we reduce mortality. Why is another reason is critical is for technical assistance. It's something everybody needs to look at. There are gaps, there are areas that technical assistance is needed to be able to forge ahead. So that is critical for us as government. Also, it will also boost coverage, very critical to put coverage, especially on rich areas. It's not every area that can be reached. When you look at the public sector, there are unreached areas. And those unreached areas, it's good to go into partnership with CSO, with private sector, to ensure that those areas are covered. So very important, so that we can cover enough areas, add to rich areas that we couldn't cover. Another one is to enhance impact. Impact that has been created. How can we enhance it? We need to align effort, critical for us to align all the efforts, effective coordination, and to reduce duplications of efforts. With this, we'll be able to achieve, especially the SDG 3 goal that every one of us we are trying to contribute to. So, and when you look at the role of government in the collaborative efforts with either implementation partners, CSO, and private sector, it is the role of government to be able to do oversight on this and guide them on these priority areas. One, we need to set priorities. The role of government is to set priorities, and that priorities will be set in terms of in our strategies, documents, guidelines, policy documents, for people to see, so that everybody will see all the goals defined, the targets, the objectives, and the strategies that governments want to see. So it's very important that we set that priorities right, so that all stakeholders can key into those priorities. And the next one is policy formulation as a role of government. We are to set policy. And that is what we are doing by creating enabling environments for partnership, for implementation partners, CSO, private sector to be able to thrive and contribute in that partnership for us to meet our targets and meet the goal. So it's all of us, it's a teamwork. And the government's role is to make sure that we have enough policy environment, setting good environment for this to be achieved. Another one is resource mobilization, which is very key, that all areas in terms of resources, allocation of budget during appropriations, and it's very important that no one is left out, because that is government. The role of government is to make sure everybody is within whatever we have been able to pull together and benefit from those resources that have been pulled together. So when you do that, you have your budget. In Nigeria, we are talking of one budget, one plan, one coordination, and one conversation. So very important. Then coordinating the donors, and that's where one conversation comes in. These are policy issues where we'll be able to come together, your voices are held, and be able to make informed decisions together. So the role of government is not just to oversee, you do it together in partnership. You contribute together in partnership. And next one is in terms of monitoring and evaluation, supportive supervision to be able to see and look at performances. What have we done? And come up with data for everyone to see, so that we'll be able to talk together and see if we are performing, which area do we need to address on time. So it's the role of government to see that, not to talk of the logistic of commodities. People say there is no program without commodities. So it's the role of government to ensure that we are able to coordinate data management, both logistic and MIE. Whatever tools we use is the role of government, and everybody need to key in to have a national figure, a national show for us to have do we have as a country. So that is the role of government that everybody need to key in. For MIE, for example, we have the DHIS2. For logistic, we have the NHLMIS. And that is what the policy says. So we need to get into this and have all both commodity consumption and the M&E and the supportive supervision oversight across the subnational to be able to now come during the coordination meeting to give report, to give feedback, so that people can be able to see what is going on at the subnational level, because that is where implementation is, that is where evaluation is being done, that is where you assess what you need, what you have done, and come up with your performance. So there is a need to supervise it and to do that supportive supervision. That is one of the roles of government. So I want to stop here. Thank you so much for having us.
Thank you so much, Dr. Oyeniyi. So you have touched on the government role as the coordinating body. Confirm that I can be heard.
Yes, we're hearing you.
Yeah, okay, perfect. You've touched on the role of the government as steering and coordinating body, everything you have talked about. So the government is in the steering or in the driver's seat. And also, not only that, you also touched on the fact that the government also does the work. You said the working together part, the actual partnership, monitoring and evaluation, setting priorities and creating the budgets. Thank you very much for that. I will ask follow-up questions on that, because some questions also came up when you were speaking. But now I want to also go from the angle of a partner to see Dr. Nonso. I want to ask, so drawing from your initiatives, the different initiatives that you've led. Polio, I know, is very large, and you've led it across multiple countries in Nigeria and in Africa. And then maternal health programs. Why would you say partnerships are indispensable? And looking at it from a practical lens, giving practical examples of the different angles that your team alone could not handle, even if there was a bulk of there was funding or support, your team alone could not provide the necessary support to the government. And what aspects of the health systems do you think that is definitely indispensable for one organization or two organizations to do it alone? Thank you.
No, thank you very much, Victory and ACE Strategy Group, for having me. Really happy to be here because partnership is really very important to us here at CEDA and even to me as an individual. In fact, it's one of our core values as an organization. And I think before I go into responding to the question, I just kind of describe the lens from which I view partnerships within the space. Because for me, I see partnership in different dimensions. There's obviously partnership between donors and government, between government and implementing partners, government, and other stakeholders in the space. I think somebody has even called out in the chat box how we often forget partnerships with the private sector, so you could even have multi-sectoral partnerships. So most of my responses are going to be coming from that lens of my experience partnering with government, partnering with other implementing partners, and even in some instances, donors and private entities. But to the question, I think why partnerships are very critical and indispensable is that they are necessary for sustainable impact. I think everybody within the space, wants to achieve immediate results, but even more importantly, results that then last the test of time, which is where partnerships come in, because partnerships, by their inherent nature, draw on our strengths and complementarity. So where as an individual or an entity, I might be strong in one piece, I can't be strong in all. So that is where creating partnerships, especially strategic partnerships, as Ota has stressed in her keynote speech, is really important. But then when you think about the sustainable aspect of it, you really can't achieve anything sustainable without government, which is why for whatever partnership we're thinking about, government definitely has some role, either directly or indirectly, because the government is the one that is there to set the policy, the direction, and the general systems that we all have to build on. But even more importantly, most of the programs that we as implementing partners deliver, are time bound. They are there for a period of time, but then government is always going to be here, and they are the ones that would make sure that whatever you build is sustainable. Just then buttressing Ota's earlier point about a community or a government-led partnership. But if you are looking for sustainable impact, partnerships are definitely indispensable. And it then reminds me of this popular African saying that says, if you want to go fast, you go alone, but if you want to go far, you go together. So partnerships are definitely indispensable because they help us tap into our complementary capabilities. I think one example that I could share at this time is on the Smart Mothers bit, because that's a program that was built on partnership and then continued and sustained on partnerships. Many people don't know this, but a major part of what Smart Mothers did was to introduce public access price heat stable capital scene into Nigeria. But that wouldn't have even been possible in the first instance if we didn't have a partnership between WHO and MSD for mothers and Ferring, the pharmaceutical company that produced that system capital scene at the public access price. So we would have even been talking of a Smart Mothers if we didn't have that partnership. But even when we now brought it to the Nigerian context, we had to form strong partnerships with the Federal Ministry of Health. That's how I got to know my Oga, Dr. Yeni, and then of course other partners in the space. So partnerships are definitely indispensable if what you are seeking to achieve is sustainable impact and change in the space. Thank you.
Okay, thank you so much. I can have a head now. Oh, yes. Thank you so much, Dr. Nonso. So I'm happy that you gave us like a practical example of a program that was very partner-led. How do I put this? That was and partnership was very important for, I would say, lots of the programs in our space, except maybe small-scale research, pilots. Most large-scale programs that are supposed to actually change the health system will not go anywhere if multiple hands are not trying to make that work. So thank you so much, Dr. Nonso. So I think my next question is going to go to Ms. Ota. You've established, right, what strong partnership, you've spoke about what a strong partnership should look like. And from everything that has been said so far, partnerships are very important. We've established that. And I think, yes, we even have missed out the private sector. Even private sector partnerships are very important. But what does a good partnership between different sectors look like, right? This is a question I would also be asking Dr. Oyeniyi as well. But first of all, what does good partnership look like? And what are the warning signs, the earliest warning signs for when a partnership among partners, either one-on-one partnership or multi-partners, what does it look like when it is going to fail? What are the early warning signs?
Okay, thank you so much, Victory. And I also echo your words. I really did appreciate the practical example that Dr. Nonso gave. So really a good segue into this question. I think in my experience, when I think about good partnerships, and good partnerships are partnerships that deliver sustainable impact. So I know we're all in the health space, so I think I would say partnerships that deliver sustainable health impact in, say, Nigeria or Africa. To me, those are the ones that I would consider good, and they are intentionally multi-layered by design, not by accident. And I know that the other two esteemed panelists have touched on some of these. So when you say, what does a good partnership look like? By that, I mean, for example, government sets the direction and owns the system. Implementation partners bring execution capacity. The private sector contributes specific resources and capabilities where it genuinely adds value. And then communities are treated as co-owners, not just end users. So when you think about this, general pot, clearly understanding what each of them brings to the table, we already have the entry points of a recipe for a good partnership. And a very practical example as well is looking at how immunization systems have been strengthened in Nigeria over the past number of years. So if I were to say, for example, eHealth Africa, the way we work with government agencies, we work with partners, we work with state health teams, we work with these all together, with everybody knowing what they're supposed to bring to the table. And the partnership works because roles are clear. So government owns the program and the policy direction. We need to get that direction from the government and work with them. Our role is to support planning, data systems, cold chain, last mile delivery, and operational execution at scale. Funding partners focus on funding. Every party is doing everything that they're supposed to do, and that is the point. So, but now coming to the question of what are the pointers for when a partnership would fail? I think first thing I would say is when there is no defined shared outcome jointly or early in the partnership. And this is something I have seen happen before, where it's not defined. What are we trying to get out of the partnership? It's not defined. So that's a very, very simple one there. If there is no shared scorecard for the partnership, then when things fall apart or when issues come up, there's going to be a lot of finger pointing and blaming, and no one will be focused on the results, but focused on who to blame for why this is not going well. So that's the first thing I would say. The next one is when decision rights are not clear. So for example, who decides what? Who is going to be, what do I adapt and what do you adapt? Who and how do we escalate? These are things that are not properly defined, and definitely when there's a crisis, that is when the collaboration breaks down because there was no clarity on who is doing what. I always would say the same thing I said earlier. What is for everybody is for nobody. Partners must define clearly their roles. I think the third thing I would say is when we don't respect our complementarities. We don't respect or understand that, we each have things that we can do good and that you can do better. It's very important. Every organization, every individual, every partner has a comparative advantage. And sometimes people are not conscious of that. So the truth is, when we don't respect that, then there's definitely going to be competition because I really want to show that I'm best at this. Whereas if I calm down, I could see that, okay, I could be good at this, but you are better at this. And how can we work together? So that is where partnerships struggle, when there is competition among each other rather than complementarity. So for me, the simplest test is when I look at a partnership, do we have one shared definition of success? And do we have one honest flow or rhythm of joint review using the same data with trust? If we do, then most partnership problems become solvable. And if we don't, no amount of goodwill, no amount of intention will compensate for the lack of structure, which will eventually lead to that partnership failing. So that's my answer on that. Thank you.
Thank you so much, Ota. Yeah, so I think I would also want Dr. Yeni to touch on that, especially from the government angle or from his experience, what a good partnership looks like, and the early warning signs from your perspective that something is going wrong or something is going to go wrong within this partnership. Any addition to what Ota has already said?
Yes, thank you very much. As government, we have a lot of examples that we can cite, we can share. But for you to know if this partnership will fail, you can know it from the beginning. When you didn't come together to set priorities, to agree on how this partnership will go very well, then you may be heading for the rock at any point in time. And that's why co-creation is very important. If you are not aligning with maybe government policy that has been set, there is a need for every partnership to co-create from the beginning. Let everyone tell what is permissible, what is not permissible through policies and so on and so forth. So government will want to see a situation, even from national to sub-national, where partnership for a goal that you have set are co-created from the beginning. We've had instances where partnership are set and approved, by government. We have the protocol where partners can submit proposals, for example, to the national planning. And the primary ministries, I'm talking generally now, who have directed, they were not part of the co-creation of the development of the proposal to align with government policies. So when it's now given to the primary ministry to implement, then you begin to see issues. And so can even go to implementation. Let me give an example of what we had in the past that couldn't work from the beginning. There was the time of anti-pneumatic shock garments for PPH. And that was what we started with before calibrated drape is now a priority for us. So there was a program where it's not in the policy. Anti-pneumatic shock garment was procured, and it's to be sent to the community, which is not in our policy. And that has been approved. It was approved. And the primary ministry was not part of that co-creation. And that project, we had to stop it in the middle, and we have to redirect it to align with government policy. So it's very important that all implementing partners co-create with government from the beginning. And that is very important. Number two is, along partnership, emergencies can happen. Issues can come up that this partnership may need to be redefined. So there must be dynamism in partnership. Yes, we've agreed on work plan, we've agreed on direction, but we should give room for support in case there are issues. And that's when Nonso was mentioning, when you go together, there can be snake bites. That couldn't have been part of what you engaged for. But you need to tackle it together. That is what partnership are. Emergencies. Emergencies can be from disaster. Emergency can be from epidemic, which initially was, you didn't plan for it. And you need to join hands to fight it together. So there should be room for dynamism in that partnership. Should in case we need emergency, all of us should come together, redefine that partnership. When we are done with it, we move forward. So it's very important that that is also considered as you go on in the partnership with government, private sector. And it's also important where there are no enabling environments. You need to talk to government. There are issues around your site, your locations where that partnership will take place. So there are informations that could have been given from the beginning. So it's very, and government have those information based on policies. So it's very important that we are able to stick to this and that we seriously help. We've done a lot of co-creation. I wouldn't want to talk about projects now. And it was very, very, very good. The outcome was good. Everybody was on board and you'll be able to work with it. So it's very important that we ensure in partnership, you set those priorities together based on government, you co-create together and you give room for emergencies where needed for you to tackle it together and move on with your partnership. Thank you.
Thank you very much, Dr. Oyeniyi. So taking from what Ota said and what you've just said, a partnership that is going to fail can be seen right from the beginning. And it is when people don't work together, don't set priorities together, or one person sets priorities and is trying to enforce it on the other. You also touched on something that is very important, Dr. Oyeniyi, around being able to change with changing times. And I think that that's something that is very important. I've sat in rooms where making plans maybe with the government and the government is like, okay, we have this particular need, which partner has some funds or an avenue to support this. And partners are like, oh yes, we can commit some of these other resources here. And that shows that they are willing to shift, to move with the current need of the government at that time, even though the initial plan was, okay, this, we are going to support with this. But right now, this is the need and we can support with that. I think that that's something that is very important, being able to support where there is need at that point. And so, Dr. Nonso, we've spoken a lot about partnerships, what could make it work. Now, in your experience, I keep asking you questions around giving me practical examples, but in your experience, there are different partnerships. I know in your particular experience, you've been able to have different partnerships with implementing partners, actual implementation, and also on the policy and advocacy angle, where we talk about agenda setting, the strategic coordination of things. I would want to ask, what do you think of these two different types of partnerships, implementation on the field or working closely with the decision-making body to make strategies and define priorities? And what are some of the challenges that have emerged within the execution of these different types of partnerships, and how were you able to manage them or address them?
Thank you very much, Victory, for that very thoughtful question. I think the way I would approach it is maybe first kind of like highlight the similarities, then maybe the differences. I think at the heart of it, a partnership is a partnership. So a lot of the principles that Ota and Dr. Yini have described are very valid, common goal and vision setting, joint accountability measures, and so on. Those stand true regardless of whether you are talking about a partnership that is targeted at implementing a program or a partnership that is targeted at, advocating for policy change, for example. I think in my experience, what has then been the primary difference between those two types of partnership has really then been around the pace. I think as most people can relate to, implementation-based partnership are usually much more fast-paced because, once you have a plan, once it's aligned with the current government policy, you can just go ahead and execute, of course, after getting necessary alignments from other stakeholders beyond the partnership. While on the other hand, for advocacy or policy-related partnership interventions, the timeline or the pace is a bit slower. And that's for obvious reasons, because there, when you're talking about advocacy or policy, you're looking at getting wider consensus. You're also looking at government or policy processes, because coming up with or changing or introducing a new policy has like a series of processes that are even sometimes beyond the health sector, because they might then involve legal or legislative processes. So for obvious reasons, those kinds of programs are usually a bit longer, and even where they end up not being as long as anticipated, is really down to how the partners are able to get that early on government buying and co-creation that Dr. Yini described, but also being very creative in how they can adapt and fast track things. But that said, I think it's also important to kind of look at these two types of partnerships from a perspective of how they interrelate with each other, because it's quite common or easy to fall into the temptation of thinking that, okay, since what I'm working on is an implementation intervention, that's really the scope or the length and breadth of it. While in reality, if you want to have a successful implementation intervention, you need to even first of all have studied the policy landscape to even know what is allowable or not allowable for your intervention, and also to have a sense of what is priority and not priority for the government, and also vice versa, because even policy or advocacy is very much or is more effective when it is built on implementation experience. So if you think about it, it's not really two distinct pieces. It's actually two interrelated pieces that form, kind of a cycle that, today starts with policy, goes to implementation, but it will still come out policy and vice versa. Thank you.
Okay, thank you very much, Dr. Nonso. So the considerations are still the same. There must be some nuances, but your point is that the considerations are still the same, and it's everything that we've talked about, making sure that there is actual collaboration between whatever partners are working together. Thank you so much, Dr. Nonso. So Dr. Enyi, there's a question in the chat box that I think I should ask now before we move on. Someone is asking that one of the things you mentioned is the role of partners in providing technical assistance to the government. How does the government navigate between, the tension between capacity building of the public sector, within the public sector, and capacity substitution by partners? Okay. Dr. Enyi, you are muted if you are speaking. Okay.
So thank you very much. In terms of technical assistance and the substitution, one thing we have said earlier, in the beginning of a partnership, you have identified area of need. You can do your SWOT analysis and be able to see where you will need a technical assistance. And let me give an example. When we started the MNH scale-up in Nigeria, during the EWENA, we were asked to prioritize 3 activities. And the second activity has to do with procurement quantification, because we do not have a formal, a streamlined way of both procuring, forecasting for MNH commodities. So in our work plan, we added that we need a technical assistant to help in the quantification. There is no data that we can use, no consumption data for government to be able to do it. So you can either use consumption data or you would use mobility data. So either way, we don't have a technical person. So we put it and send it to WHO in that partnership to help us seek a technical assistant to do this for us. Not knowing that the technical assistant that we need after bringing all stakeholders together is right here in Nigeria. And we didn't go back to WHO to get the technical assistants. We were able to get that technical assistance here in Nigeria, and we were able to do the quantification with the support of that partnership, everybody together. All the partnership in MNH commodity space, we came together and were able to pull it out, pull it through. Today, our quantification is being used in West Africa for other countries to use. So, and with that, we're able to come up to be able to do this. So you can identify your need from the beginning and be able to go through it in that partnership. Identify those areas, identify what you need and where you are looking at that you may get the technical assistance in partnership. That partnership can come up with something you can never thought of and be able to solve the problem. It will reduce waste, will reduce costs, and many other things. So it's very important, technical assistance in area where it's not available, and partnership will be able to solve it for you and reduce cost of doing it. Now, in terms of substitution, yes, capacity building. Let me give an example. We are also trying to do local production of MNH commodities. Generally, we are doing for malaria vaccine production here in Nigeria. Those are local productions. And we're already talking about MNH commodity. How can we do that? And the best way, for example, calibrated drip, we can only have 2 people doing here in Nigeria, for example, companies. But when you look at the technical specification we have put in place, we need to scale up to about degradable, which is not yet in Nigeria. So in getting that technical substitution, for example, we may need a transfer of technology. And it's in the partnership you can get it. A transfer of technology from where we have degradable coming to Nigeria to substitute what we have local, and they can go into competition based on the technology that we have. And everybody will be involved in getting it done in partnership. It's not that we will load it. It's going to come in based on technical specification. We've all agreed together, both by private sector who are into it and government has agreed and as approved by the coordinating minister who directed. So the two, they are acceptable in partnership where needed, that will help us to get to our goal, to get our target as easy as possible, and doing it together. And that's why that planning together is always very important. Coming together, coordinating together, and be able to come up with decision together. So in partnership. And that's how I will be able to answer that. I don't know if that has helped us.
Yes.
The person that asked.
Yeah, I think you've been able to answer the question very well. I hope the person that asked, you can give a thumbs up that the question has been answered. But from what I understand, Dr. Yeni has said that technical assistance is very important, especially when there is a need. Building capacity for that need is going to take maybe a long time, and partners have that capacity. So building that, utilizing that technical assistance can very well help to improve the project. And also he talked about still capacity building. There is also still room for capacity building of the staff. Thank you so much, Dr. Yeni. So while I ask the last round of questions, I'll also be looking at the charts to pick up some questions from there to ask. But this angle is around sustainability, looking at partnerships through the lens of long-term sustainability. Ms. Otta, you talked a lot about technology, utilizing technology. And I know that is one of the things that eHealth Africa is known very well for, coming into partnerships with technology, the dashboards, the data and everything. So from your experience within eHealth Africa, how have you been able to leverage digital tools and that data-driven approaches to strengthen collaborations, to strengthen transparency, to strengthen shared values among partners? And has there been any challenges or bottlenecks with actually producing data around a particular issue and then there being pushback from partners? And how was that handled?
Thank you, Victory. One of the biggest mistakes we can make is treating technology as an add-on. So something that we layer on top of partnerships after the fact. And what I know from our experience is that in the partnerships that work best, technology functions as shared infrastructure. We are a health technology company, so we know that when technology is treated as shared infrastructure, its partnerships work best, and it's what makes coordination, transparency, all the things you were talking about, joint accountability. That is what makes them possible at scale. So specifically speaking to eHealth Africa, our focus has been very practical, and that is helping partners move from fragmented data sets and parallel reporting into a single shared view of performance so that planning, monitoring, and course correction happen together. And that is, in a nutshell, that is really what we do as a technology company. So a concrete example is digital microplanning for immunization. Historically, like many people on this call would know, different partners were working off separate spreadsheets and paper plans, and it took such a long time. And it really made coordination slow and error-prone. But by supporting states to use shared digital microplanning tools like Planfeld, everyone from the federal agencies to the state teams to implementation partners and even to donors, everyone can work from the same settlement level data. And that means gaps are visible early, duplication reduced, and decisions could be made jointly rather than retrospectively. And when we think about partnership for good and leveraging technology to make the lives of partners easier, that is a practical example that I can bring to the fore. Another example is when we look at logistics and supply chain visibility. So we have a tool called Loomis, which is a logistics management information software. And what it does is it makes vaccine distribution data visible across partners in near real time. So instead of reconciling reports a week later, partners can see where stockouts or bottlenecks were emerging and then respond together. And that is also another way of leveraging technology as a technology company to make coordination among partners more seamless and easier to handle. And when you look at that shift from delayed reporting, from tempers flaring, because you're waiting from one partner to bring a report and it's taking time, to shared real-time visibility, that fundamentally changed coordination dynamics. And the principle behind all of this is very simple. It is shared systems, not side systems. I know that every speaker here has talked about it, and that is just so important. Having a mindset around shared systems, not systems in parallel. So what we do is, in these kinds of partners, and especially as a technology company, we standardize data definitions. We align reporting structures. We agree upfront with partners on how data will be used. It's something that has to be agreed from the get-go, how it's going to be used safely, how it's going to be used responsibly, so that partners are acting from the same source of truth. Because that is really the trust topic we're talking about. Partners are able to act from the same source of truth. When performance is visible to everyone, accountability stops being personal and becomes systemic, because we have the tools to enable that to happen. And then when that happens, something very important changes. Partners spend far less time reconciling spreadsheets and defending numbers, and far more time improving delivery where it actually matters at the states, at the facility, at the community level. And so, to your question, for us, digital tools are not about sophistication, really. They are an enabler. They are about reducing friction. They are about working with partners to strengthen trust among partners. They are about making collaboration operational, not just aspirational. So that is what we do as leveraging the digital tools that we create. I don't know if I covered the second part of your question because I don't remember it right now, but I hope I've been able to answer your question with this.
Yes.
Thank you.
Yes. You've been able to answer the question, and you've also touched on one of the questions that was in the chat box that asks how we can improve trust among partners. So one of the ways you have talked about is utilizing digital and data systems that make everything clear, right? And I think I'll also be passing that question on to Dr. Non. So as a first half of the sustainability question I want to ask, taking from lessons, Dr. Non, so from the polio eradication program and the maternal health partnerships, how do I put this question? First of all, how has trust been built within the system? Because I know that there are a lot of partners working in the space across different things, so many different partners. How has the program been able to build trust? And how has sustainability been considered within the polio program, to considering all the partners and how the program can be sustainable long term? Thank you.
Okay. Thanks a lot, Victor, for that question. I think just as with even human relationships, right, trust is earned and built over time, but I think what then determines how trust comes about is, some of the things we've talked about today, right from the beginning, having that shared vision or defining that shared vision and the outcomes and also assigning, some kind of accountability to it. And why that vision is very important is it's going to keep being like the reference point, because health programs are usually very complex. In fact, I often describe it as fixing a moving car. So like you have a car that is emotional, you have to be fixing things as you go, correcting things and changing. So you would along the line or down the line need that North Star, that reference point that you keep looking to say, okay, what are we even trying to do here? And that would always be like the reference point that lets everybody around the table objectively assess if we're heading in the right direction or not. I think the other thing that kind of fosters trust in addition to what Otta has described in terms of treating technology as infrastructure, for example, is also noting that in these kinds of things you can really never over communicate. I think that's one of the things I learned earlier on, because a lot of times where distrust or conflict setting, it's really just down to communication and that's lack of visibility and assumptions that, oh, this other party or this other stakeholder knows. But I think if you take a mindset of you can frankly never over communicate, you would then err on the side of caution and never find yourself in those kind of situations where somebody feels left out or not carried along, and then distrust definitely sets in. I think Otta has also made that point about like even setting up systems in such a way that everybody can have access to the data at any point in time. Because I have also seen several instances where partners might begin to have distrust when they feel like, okay, it's just somebody that is hoarding the data or the information. So as we think about program design, as we think about program implementation, we need to design them in such a way that the information is there. We can have regular convenings and so on. But if you design in such a way that anytime anybody needs to even know what's going on, how things are going, they can always access the data themselves without feeling that the data is being policed. I think that always fosters trust. For sustainability, I think it's really just down to the government leading it. I think one of the reasons why I'm personally excited about the direction in the last 2 years through the SWAP approach is the fact that it puts government in the driving seat. And even before we kind of took SWAP as an approach, where you had seen health interventions or health programs or health systems succeeding in the past, it was usually in places where the government or a government agency decided to intentionally take that leadership position and serve as the guide that kind of sets the priorities, but also more importantly, serves as the filter that before every intervention comes in, they screen it to make sure this aligns with the priorities and the outcomes that we're looking for, and we are tracking. So I think always thinking of having government at the center directing, because they also have that advantage position of seeing the bigger picture that no single partner can see on their own. Is a very critical, or probably the most critical ingredient to attaining sustainability. Thank you.
Thank you. Thank you so much, Dr. Nonso. I think there's somebody that is agreeing with you in the chat box that said that, yes, the backbone of sustainability is the host government, authority, political will, and support driven by sincerity of purpose. Thank you very much, Jimoh. Thank you, Dr. Nonso and Otta, for telling us about trust and how sustainability can be built into partnerships. So lastly, Dr. Oyeniyi, looking ahead into 2026 and beyond, what do you expect, or what are your priority actions that you want partners to take? What is the one final word you want to speak to all partners, everybody watching this, we as ACE and everybody listening to this, to say, when you are building partnerships, either with the government or with each other, this is what I want you to make sure you prioritize?
Thank you very much. As we look ahead in 2026, we want to see a more active coordination among within the partnership. We have set the pace. SWAP has been used to set the pace. We have all the policy documents in place. So I want to see better coordination. As we go into 2026, the minister will be able to come up with like 7 SWAP TWG. And that is where the coordination of all the areas will be. It's like a family unit. So we want the coordination to be more effective, and my partners should also ensure that that partnership is move forward through a better coordination in those areas and support the coordination that we have set up. Then I also want to look at that alignment with government-led strategies, so that everything that we do in partnership should align with government strategies that we already know, plans, implementation for us to reach our targets. Alignment is very important, so that the government will be able to lead and lead successfully. Once it is aligned and everybody goes with what government has proposed and everybody agree with. There are issues that partner may want to raise about the partnership is normal, and that can be reviewed. And that's why I said there must be dynamism in partnership. The two of us must agree to move forward. So it's very important. And also, the third one I want to talk about is about providing flexible funding. Flexible funding and boosting budget support, so that there can be transparency, should be accountability. And that can be done within the concept of coordination, where each partner gives feedback and be able to also see what they are doing and be accountable. And government also can do the same moving forward. So these are the things we would like to see. Also, we would like to see boosting local capacity in the partnership. Boosting local capacity. With the advent of things that are going on in the last 2 years, you will know that ownership is very key. We can wake up tomorrow and have another news. So in that partnership, sustainability should also be looked at this year. How can we build local capacity and ensure there is ownership both at national and sub-national level moving forward through advocacies and through partners, getting that understanding down to the subnational government. That is in a residual list, and we need to understand that. So in moving forward, where the implementation is, that is at the subnational, there is a need to ensure that their capacity is built enough to be able to handle the sustainability that we are driving at. That when the partnership stop, based on your initial agreement, this partnership is for 3 years. We need to prepare that from the beginning. And we need to let the government, either the state or subnational, know from the beginning that this is our sustainability plan. And it has to be there, agree on from the beginning. Partnership that is not scalable cannot be sustainable. It has to be scalable. You have to look at what you are doing. Can you scale it up after the agreed years? So we need to look at what we are doing and review it if it's scalable. I've seen a lot of projects in this country that died after the project support or the partnership stops, because either it's not scalable or the government is not giving that impression from the beginning when it's being built. either at subnational and national level. And I want to see one data, one M&E. We are having a lot of parallel data, a lot of parallel platforms, and in partnership, like I said, we need to be dynamic. Where there are issues, you need to speak, you need to communicate, and government can find a solution. But when there are parallel data management, parallel platform, programmatic data that are not even entering the national tool, either the logistic tool or the M&E tool, from that partnership, how will government be able to use data for decision making? So I want to see that one M&E, one data into the national tool, either as M&E tool or as logistic tool. The NHLMIS should be one. There should be interoperability. We want data from programs, from partnership to enter the national tool. That's what I would like to see. One plan that will be able to implement together, be able to review together regularly as changes are taking place. We want to see that in 2026 to be able to meet our priorities. Very important. One conversation like what we're doing now, we need to talk together. It's very important for us. We need to do more of it and activate our conversation to be one. I think with this, I want to say thank you.
Thank you so much, Dr. Oyeniyi, and thank you. That was a very clear list of things that we should be going into 2026 and beyond with. And it's a lot of the things we have touched on, and that is why this conversation was convened, to think through. The year is starting, and there is a lot of partnerships already on ground. There's a lot more that will be built. What are the things that we must put in place to make sure that we are delivering impact as well as sustainability? I just want to say a huge thank you to all our speakers, our guests today. And I'm very sorry that we are a little bit behind time. We are going to be closing shortly. And that leads me to inviting our managing partner to speak a little bit on ACE's angle, just for a few minutes, on how ACE sees partnerships and collaborations and what we would love to do going forward. I would like to invite Afeez Olajure.
Thanks, Victory. And the invitation looks more like setup because my bosses have spoken already. So I don't know what more I should be adding. So a lot of gem has been dished out. My notes are full. And first things to say, thank you, everyone. This has been very insightful. A lot of beautiful perspective has been shared. I think 3 key things have been well hammered over and over during the conversation. 1 is trust, 2 is sustainability. And I think the 3rd thing that I really love is efficiency. And that's really the ACE reflection. So how we view partnership is, as much as we are advocating for people to partner and everyone to work in synergy, we also, I think the country, the donors, the partners, everybody needs to hold some minimum standard that is acceptable. Because an angle to partnership is I'm going to a particular state or country to work, and I need to look at what the people that have gone before me have done. But I will know how important the accuracy of data is. So the partnership is good when I actually trust the outcome of the work that has been done before I got to the state. And that's the only way I'm able to say, if I pick this data, I can run with it. And yes, that's why I love the emphasis on trust. I think the second piece is also around from the donor lens. I think what the government has done around SWOP, getting everybody to have one plan, one budget, one mission and all, I think we also need partnership to be strengthened at that level of the donor as well, which is what we advocate for most of the work we do at ACE when advising the clients, the donor in this case. which is beyond granting or funding a lot of people to do many work. There should be someone who is piecing together and reinforcing the message of partnership to ensure that people are not just working in silo and we are not having a lot of beautiful excellence. And where we are looking more at having some very synergistic efforts, and there is opportunity for complementarity in everything we are doing. I think that's also one bit that I feel we strongly advocate for as ACE. And there is one thing I will be inviting everyone to do more on this journey is as we do all of this work, and this question is quite timely at a point where the country is experiencing a lot of funding cuts. When I wake up every day, I just refresh my email or any of the pages I subscribe to, because I know I hear something like so person has withdrawn their funding or there's this funding cut here and there. And I think this is a time where partnership should no longer be a buzzword, but it should actually be what we live. Because we now live in a time when the resources are scarce, and it would be very, very strange if anyone still prefers to embrace a parallel approach of doing things, because that means you will spend a lot of resources to reinvent the wheel for a lot of things that has been done. So for us, this has been a very interesting conversation. Trust, transparency, sustainability, and of course, everything targeting some efficient outcome will be one thing. The second bit is, as we do the partnership, we should look at it less from the angle of client to client, grantee to grantee, or donor to grantee, but more even partnership with the community structure, the people at the lower level. So if I'm designing a program for children of under 1, those are my first partner. So I need to think about them. And in all of the solutions I create or co-create, I must ensure that they are at the forefront of what I'm thinking through, because those are the partner, because they are the recipients of all of the interventions and the beautiful plans that we have. So for us at least, that's how we view partnership, which is why we are very, I don't want to use the word selective, but intentional in the people we have as our partners. Thank you to all of the amazing partners we've worked with in the last few years. Thanks, Solina, EHA, Gate Foundation, Federal Ministry of Health, MPSCDA, NHIA, NCDC, and all. We are very intentional in ensuring that our partnership is not just to do our work and leave, but it's more of seeing how the small piece we are contributing to what you are doing is serving as a missing piece, and also leaving the space for future intervention. We are ensuring that our intervention sits right well within what you have on grant, and also laying a solid foundation for who will be coming in future to key into all of the beautiful things that you are looking to achieve to, of course, accelerate us towards universal health coverage, sustainable development goals, and all of the beautiful world we all want to wake up to. I say I look forward to a world where my children will only understand what they call maternal mortality because they saw it in an outdated magazine. I look forward to a world where under 5 mortality looks like, oh, so you mean there was a time where 2 in every 10 child dies in a particular state, and people actually doubt that you are lying, and it looks so unreal to people. So, and if that is the world we all dream of, if that is the world we all want to be part of, we need to start bringing all the good helps together, strengthening the partnership, ensuring coordination is at its peak, and we are getting the quality output we all desire. So thank you everyone that has been part of this conversation. This is excited to all of the partnership that will bet multiple results over the next few years. Thanks, Dr. Chukwunonso. Thanks, Ota. Thanks, Dr. Samuel Oeni. Thanks, all of the participants. Thanks, Dr. Victory, for leading this conversation. Over and out from me.
Thank you so much, Afiz, for coming in. I wasn't planning to set you up, but you did very well. Thank you so much. And thank you to everyone that has been part of the conversation to this point. We are hoping that this is not just going to be a conversation that ends in a webinar. We often go ahead to make sure that this is communicated, this is converted into a communique, is shared across board for even people that were not on this call. And in this particular case, talking about partnerships, we are looking forward to a space where the wheel is not reinvented. The wheel is not reinvented at all. If EHA has a system that has that is needed for another program or project, even if it was done for maternal health, and then where a new project is being brought up and EHA can be contacted. That is the world that we're looking at, where the wheel is not reinvented and the government is at the steering of every partnership we do. Again, thank you so much, Ota. Thank you so much, Dr. Nonso. Thank you so much, Dr. Samuel. I'm very grateful to have you here. And for those that had questions and we were not able to take them, please, we are going to be responding to your questions. We'll be, any question that we cannot respond to, we'll definitely be asking for help from our speakers today to just give us a response, and we'll be sending them to you on your emails. Thank you again, and stay tuned for the next ACE webinar. It's your host, Victory. Oh, there is a poll on the screen. Please do well to help us fill the poll so that we make sure that we are giving you the very best quality of webinars. Thank you so much.
Thank you, Victory. Thank you, Hafiz. Thank you, Dr. Nonso.
Yes.
Goodbye, everyone.
Thank you,
Really.
Dr. Hafiz. Thank you, Dr. Nonso. Thank you so much for all you people do to support government. We really appreciate, actually, seriously. Thank you so much.
For always hosting us, Dr. Yeni. Thank you so much.
Yeah. Well done.